All right, well, let's continue. So when we last left our story, we were talking about some of the cultural aspects of menstruation. Were we more the unclean or the life-giving? Yeah, right. We often think of it as pretty negative. And how we experience menstruation and the effects of menstruation actually kind of follow that same line. So the more negative stuff we hear, take Psych of Gender, we really get into this. The more negative stuff we hear about menstruating, the worse we expect it to be, and our experience of pain is really subjective. So we have a tendency to feel more if we're told it's a really awful thing. Now that doesn't mean that regardless of culture, some people won't have extreme pain, right? If I've got endometriosis, I'm going to be feeling pain whether or not my culture says it's a good or bad thing. Right? But for many of us, there's not something big going on. It's just uncomfortable. Now, I will say when it comes to comfort, I feel like it's an ad for all the other classes, but one of the things we talk about in social psychology is that when we're uncomfortable, we have a tendency to aggress. What does that mean? What does aggress mean? Yeah. We want to punch in the face, right? We are verbally nasty. Does that sound familiar? That's kind of what we talk about this, right? And so this doesn't have to just come from hormones, although certainly hormones can affect it. It can just come from being uncomfortable, right? So a set of severe symptoms associated with menstruation. Now it is premenstrual, right? So the symptoms are supposed to come before day 1 of the cycle, right? Which is always first day of bleeding. But women report symptoms at really all points in the cycle. It just depends on the person. So that may tell us that there's more influence than just biology when it comes to our experience of pain. But that is true for everyone. It's not specific to this. What's dysmenorrhea? When did we see dys before? Not necessarily in this class, but just in general. Where?
Yeah.
After, not after? No? Good guess though. What's during? No? Something that's happening with it. In fact, often associated with this. This can be a symptom of this.
Is it like pre-bleeding?
No?
Okay. I was trying.
Yeah, no, I like it. I like all guesses. Guesses are free.
Makes me think of like the word dysfunctional.
That's exactly it. Yes, the same beginnings, right? It means that it's not going well. And in this case, it's causing a lot of pain. So pelvic cramping and pain during menstruation. Now we already know that the uterus is doing that, right? Did we talk about the balloon? Did I already give that analogy? Okay. So, right, the uterus is cramping, that's causing pain. It can cause a lot of pain in some people, a little bit of pain in others, depending on the person. And so, this can be caused by endometriosis, right? It can be caused by lots of different things. It can be just part of the natural process. It can be caused because something has gone wrong in terms of the endometrium growing on the other side, or an ectopic pregnancy could cause dysmenorrhea. Because your uterus, right, if an ectopic pregnancy, your uterus may think, well, there's no baby in here, so I can let go, even though there's a baby that's growing in the fallopian tube. What's amenorrhea? And it'll be a verbal test, right? Vocabulary test, that's what I'm doing.
Like not happening.
That's exactly it, yep. Amenorrhea means it's not happening. What can cause it not to happen? Yep. So sometimes it's planned, right? We know that it's not going to happen. What else can cause it?
Nothing at all.
Well, meaning like I'm not having my period, but nothing really is different?
Well,
Or,
sometimes that happens where like you just don't have a period.
it's absolutely true. Usually there's some reason for it, although the human body is fun stuff. Sometimes it's just being stressed. Stress can cause it. So when you're in college, your period can be all over the place because you're experiencing stress on a pretty regular basis. What else can cause it?
Getting pregnant.
Yeah, pregnancy. I like it. It's usually our first sign, right? What else?
Someone told me like if you drastically change your exercise routine.
Well, especially if you, not necessarily drastically change it, but if you increase it greatly. You need fat in order to menstruate. So the idea is fat, stores all the good stuff that we can live off of, right? If I don't have food for a while. So if I don't have a lot of fat and I'm trying to keep a baby alive and have enough for a baby to grow, that's not good, right? So our body is kind of set up, so we need a certain amount of fat in order for that to happen. We can also go the other way. If you have too much fat, we'll see amenorrhea. So people who are very large often will stop having periods too. So we need like this happy little Goldilocks middle ground, right, to menstruate. What else can cause it? Something I'm looking forward to.
Menopause.
Menopause! I'm so excited. Get close. 44. Oh, I can't wait. Okay. We'll talk about that too. It's good stuff. All right, sex during menstruation. Good, bad, indifferent. Good, bad, ugly.
Very culturally looked down upon.
I like that. Culturally looked down upon. What about safety-wise? Is it good? Is it bad? Is it dangerous?
Doesn't don't orgasms like help with cramp pain?
Yes, they do. That is a nice come-on line. Like, hey, orgasms help with menstruation. But people may not necessarily want that because we do have that cultural piece, right? So really it's up to everybody who menstruates whether or not this is what they want. Some people say absolutely not, I don't like it. Some people actually have an increase in sex drive during menstruation. It is nice because normally, right, we wouldn't be able to become pregnant. It does find a way, but so it really depends. In terms of safety, I did hear, so a student's father gave him this advice, and I really, really liked it, so I kept it for myself. He said, son, you can swim in the Red Sea, just don't drink from it. That's pretty good. That's pretty good. Human blood in our stomach is not good. It does make us sick. Blood in general makes us sick. Not that you're ingesting a whole lot of it, but if you're worried about STIs, getting blood into your mouth, especially if you have any kind of cut, if you don't actually have any way for the blood to get into to your system, it'll actually go into your stomach and it kills any kind of bacteria or viruses. But we have a lot of that, right? Where we have a little cut on our lip or something like that, cut on our tongue. If you're not that much of a flosser, you may have bleeding gums, so that may give a way right into your bloodstream. But culturally, we usually say no. However, anybody know anything about Hell's Angels? Any Hell's Angels trivia fans out there?
Not really.
No? Do you know where I'm going with it?
I have no idea.
No idea. All right. Has anybody heard of Red Wings? All right.
The
So
hockey team?
the what?
The hockey team?
Is there a hockey team called the Red Wings?
Yes, I think so.
That would be hilarious. I would love to get like a jersey or something from that because that's funny to me.
It is a wing and it's a red
I like it.
jersey.
I would just be my own private joke to myself. So with the Hells Angels specifically, they had a cultural tradition of if you perform oral sex on your girlfriend while she's menstruating, you can paint the wings on your Harley Davidson red. The idea is you're a super manly man because, so it's weird because it's kind of celebrating it in some ways, but it's celebrating it through the idea that it's so gross, I'm a total manly man and I can handle it, that, I can do anything in there, right? So it's a little bit of an odd message, but it really does show us that there are so many different ways of looking at this, right? Even within our own culture, we'll have subcultures that'll look at it differently too. So yeah, if you ever hear red wing jokes, now you know what they're talking about. All right, so this is the most common cause of amenorrhea. A, anorexia, B, pregnancy, C, too much testosterone, or D, overabundance of physical exercise. Think about it statistically.
They are the Detroit Red Wings.
Detroit. I'm totally getting into it. Just be cracking myself up the whole time. Okay, 8. One more? Oh, there is one more thing I want to talk about before we move on. I just saw my little notes. Yep, that is what I'm looking for, as majority have. It is pregnancy. Yeah, if we look at statistically, this definitely happens way more than anything else, which is good, right? So the thing I wanted to add to it, has anybody heard of PMDD? Nope. So that's premenstrual dysphoric disorder. If you take abnormal psych, that's one thing you'll be talking about as well. It comes up in that. But it's the more extreme version of PMS. So PMS, anybody with a uterus can experience that and may experience shades of it. But PMDD is more of, I can't get out of bed because it hurts so much. I can't go to work because it hurts so much. And it does have to follow according to the DSM. What's the DSM?
It's a dysfunction as a disorder.
The what?
Dysfunction equals disorder, so if it's interrupting your day-to-day routine.
Good job. Good job remembering that. I like that. Yeah. I'm so proud right now. So one of the things we talk about in abnormal psych, I was just asking what the DSM was, the Diagnostic and Statistical Manual. But one of the things we'll be talking about in this class as well, when it comes to different variations in how we function, is if there's no dysfunction, there's no disorder. So I can have cramping and go to work and things like that. That's not dysfunctional to my life. So therefore, there's no disorder. But if it starts to impact my life in a negative way, I can't do things, I'm ruining my relationships because of aggressing, those kinds of things, then we'll talk about it as a disorder. Does that make sense? So it has to cause some dysfunction. Yeah.
Okay, so I think of dysphoria and I think of like,
Gender dysphoria.
yeah,
Yeah.
I just thought, well. what's
It's a
the-
weird word for them to use
Yeah.
in this one. Yeah.
Okay, I was confused.
I don't even know, I couldn't even give you the reasoning behind it, why they chose dysphoric.
Okay.
I don't know, I'll put that up for extra credit. What was the reasoning behind that name? Because, yeah, it doesn't really match how we talk about dysphoria of feeling like I'm outside of that experience. That doesn't have that, so.
Okay.
Yeah. No, I'm glad you brought it up. So remember, the first person who emails me the answer to that gets that extra credit.
Do we get an A for the class?
And all right, but finally, let's move on to the mail. So a lot of the things that we talked about last time, right, are still true, right? Things like the breast, we're not going to cover that again because we know that they're exactly the same, except what? It's the one thing that's different generally?
Right.
Yes, how much fatty tissue there is. That's it, right? All right, so poor guy, we split him open to see what's going on there. But we can see a lot of the same things, right? Just offhand, you can probably see some of the structures that we saw before without me even labeling it. Any guess what that is?
The bladder.
The bladder, you got it, because it's the same kind of thing we saw before. Any guess what that is? The pubic bone, yeah, same thing we saw before. Now things get a little different in that, right? already recognize some of them because we've already seen them in the female. But luckily, you guys do not have a big uterus right on top of your bladder, right, to collapse it at will. So there's that pubic bone. Still, it is protecting the bladder. It's actually also protecting the prostate, which we'll talk about. Really, really, really important organ for males. But gentlemen, unfortunately, you have all your reproductive stuff on the outside, right? Which makes it much more vulnerable. But we're going to talk about why it's necessary, or at least why we might have that, why human beings might have their reproductive organs on the outside, why gentlemen might. All right, so here's another funny little bit about the human male, is that, well, this is really a funny thing about scientists, because this really has nothing to do with your body. We are going to talk about the same tube and give it 3 different names, depending on where it is. So this is, well, I should probably go the other way, huh? We're going to start in here. We're going to call this something different. We'll get to that. It's going to come up here, and then it's going to become the vas deferens once it gets out of the testicles. Then it becomes the vas deferens. It's going to mix with all these things. We're going to talk about that. We're going to go through the prostate. Going to mix with some things there. We're going to go through here. What's it going to become? What are we going to call it when it comes into the penis? The urethra. Urethra. So it's the vas deferens from here to here, but then it's the urethra. It doesn't change, right? It's the same tube, but we're going to call it 3 different things. Yeah. Vas deferens is probably the thing you'll hear the most of urethra, or urethra you hear more, but vas deferens you will start hearing now that you've heard the name. All right, but back to our Harry Potter spells, right, that we had last time. Do you remember what the other one was? What it sounded like, even?
Corpus called. Starting with the C, didn't it?
Fill something, yeah.
Cavernosa.
Cavernosa, corpora cavernosa, right? Here we have the corpus spongiosum. The reason we say corpa and corpus, it just means multiple or 1. So we only have 1 spongiosum. We actually have 2 of the corpora cavernosa, which is the part that's going to fill with blood. What does this sound like?
SpongeBob.
It is SpongeBob. Yeah, SpongeBob is in your penis. No, it's not. But it does look like that. It kind of means that it's a spongy body, right? Corpus means body. So this is going to wrap the urethra. It's going to kind of create a little, what do you call it? Like when you take an electrical thing and you wrap it. What's that called?
Electrical tape.
Yeah, but
Insulating.
insulating. Thank you. That's what I was looking for. Yes, the more general. Yeah, yeah. It insulates it, right? So it protects it from damage, and it gives it a nice home. And we'll look at it inside as well. We'll slice the poor thing open and we'll have a look. All right, but there's that corpora cavernosa, right? Same thing. So in the female, the 2 corpora cavernosas that would have made a penis, if it was given that chromosome message to do so, instead splits for the clitoris, right? So it's the same structure, but it splits and becomes that wishbone, right, for the clitoris. Here it's together as part of the penis. Same structures, they just grow in different ways. You probably already know that we call it the penis. We will often call the head of the penis the glans penis, just like we'll call it the glans clitoris, just means the larger structure. And there's the urethra. We talked last time about urethral play, right? What do we need to be careful of with urethral play? We put stuff in our urethra. What do we have to be careful of?
Damaging it.
What?
Damaging it.
Damaging it. Yeah, that's the biggest part, right? The little boy puts a stick in there. Yeah, creates some damage. So, what's that? When we say damage, what we mean is scar tissue, right? It creates some scar tissue. What's the problem with scar tissue? Do you know?
Doesn't go away.
It doesn't go away. Yeah. What else does it not do?
Hard to like pass
I'll come stay again. So it has no stretch. If you've seen anybody, if you've had a scar too, you may find that over time it pulls a little bit because there's no stretch to scars. So we need some stretch, right, in that. We need some pliability. So one of the things that happens if you build up scar tissue, let's say you keep putting things in your urethra that keep creating scar tissue. The other thing that can happen is repeated exposures to an STI. That can cause a lot of scar tissue buildup as well. So here's the unfortunate part. So they have to get rid of that scar tissue. How do you get rid of scar tissue? So you have to cut it. Right? So here's how they do that. So this is a really big version. But this would be spiky balls. Yeah. So little spiky balls, and they would put it into the urethra and do this. Because they got to break that up, right? Yeah. Yeah. So take care of your urethra. It's a necessary piece. Because if it becomes to the point where I can't pee, that's life-threatening. Right? So we have to clear that out. All right, there's that glans penis, just talking about the head of the penis. And the opening of the urethra. There are a lot of exposed nerve endings around the urethra, which is why people stick things in there, because it's pleasurable. But it can be easily damaged, so we solve that with the proper tools and what?
Lube.
Lube! Lube's always the answer. Thank you.
Jump right in there.
Glad you're with me. All right, the rectum. Same thing that we saw in the female, no difference at all. And here's where we get to interesting stuff. I'll get rid of that image. It's disturbing. Right. Seminal vesicle. It's just fun to say. So, how much of semen is sperm? Guesses.
It's only about 30%.
30%? Do you have any other guesses? Guesses are free.
10%.
10%. All you have to do is spit out a number at me, right? That's it. That's the only-
25%.
Thank you for giving other numbers, no matter what they were. All right, so you're all wrong anyway.
Well then.
I know, right? It's making you answer just to say you're wrong. All right, so let's do the breakdown. So 65 to 70%, and you can see different numbers. It really depends on the source, what they determine. So that comes from the seminal vesicle. That's right there. It's not close. Yeah, let's go. Any guess where the other bunch is? There's going to be another big bunch.
Testing.
Well, that's just where the sperm's coming from.
Oh.
Prostate. Good job. Yeah, we talked about it a little bit last time. So the prostate is going to make approximately 28 to 34%. Everybody's different. It's the prostate that adds calcium to the semen, which makes it cloudy, just in case you wanted to know. And only 1% is sperm. So the grand majority of what is released is not sperm. It's all the stuff that allows sperm to get where it's going, right? So it needs all of this fluid in order to transport it through this huge vast deferens, right? Although it's just the sperm that's going to go to here, then we're going to mix with all these things, and then it can go out the penis and go wherever it's going. Just in case you wanted to know what semen is made out of, there's a lot of fructose. What is fructose? Sugar. Citric acid, zinc, and amino acids. Again, should not harm you in any way unless we're dealing with STIs, in terms of if you happen to congested or getting in your eye, although we'll talk about the eye when we get to STIs.
Oh.
I get too happy about that, I gotta stop that.
Weird question about
Please.
sperm is I've heard that various foods can distort.
Yes, so let's see if I have that in my big bag of penises. That is one of my many things. So what it comes down to, I get a lot of weird gifts, by the way. And this was one of them. Oh, it's not in here. All right, I'll have to get it next time. So it's a product called Semenex. And the idea of it is it's supposed to change the taste of your semen. If you look at the ingredients list, it's mostly fruit. So fruit is really the thing that does it. I had a student that worked at Jamba Juice, and they did experiments, and they found pineapple was the most powerful of it, and that was actually the first ingredient on the Semenex. So it made sense that that was the case. Meat tends to make it taste bad.
That's what I was.
Yeah.
That's what I was gearing more towards. I was
yeah.
like, I've heard that meat can distort the.
Yeah. Meat generally makes it taste bad. Fruit makes it taste good. That's actually the same thing with vaginal fluids. Well, we find a very similar kind of thing. We're dealing with the same process, right? Yeah. So, if you're worried about how your genitals taste, fruit. Any other weird questions about sperm? I love weird questions about sperm. All right, if you think of anything. All right, the ampulla. Ampulla just means flask. So it's a little flask-like structure. So this is where things are starting to mix. So we've got the sperm, got only 1%, right? A little bit of sperm coming in. We're going to mix it with the seminal vesicle. And it's going to go down the ejaculatory duct. That should be a T there. So it's going to cut off. T. So just like the milk ducts, it doesn't make it, right? It just transports it. A little bit of I don't know, I guess vocabulary. So some of my favorite terms. Once the semen gets to the ejaculatory duct, there is no turning back. We call it an ejaculatory inevitability. What's that mean?
It's inevitable that you're gonna ejaculate.
Yep. So you can control it somewhat, right? Men and women, anybody can control orgasm to a certain extent. But once it gets here in terms of a physical sense, once it gets to the ejaculatory duct, there's no controlling it. It is going to come out. It is going to happen. I have a few fun vocab words for you today. All right, and then there's the prostate gland. So the prostate, I often call it the magic organ of the male. I did have a conversation with two guys in a pool in Mexico, and I was telling them how amazing their prostate was. Like it's like it's really cool, guys. They appreciate the information, at least that's what they said. But what are you going to say to some weird random woman who's telling you about your prostate?
Pretty sure they were judging you.
I'm sure. Yeah, summer I get a little punchy and I want to teach somebody something. And so I just start like randomly doing it. All right, so what makes the prostate magical? Anybody know anything about the prostate?
That's what helps.
It helps.
Huh?
It helps.
Pee.
You will have problems peeing if the prostate is enlarged later on, which it will become. Yeah, later. No? Oh, I thought I heard something.
I just always hear about prostate cancer and the risk.
Yeah, so prostate cancer, gentlemen, you are most likely to die with prostate cancer if you live long enough. Prostate cancer is the most usual, it's the most common, but it is really slow acting. That's why I said you will die with it, not of it. Does that make sense? So let me get the statistics. They're interesting. All right, so it's the most common cancer for those over 45 80% of the men who die in their 70s have prostate cancer. So it's not what kills them, but they have it, right? It is also very curable. So we do a lot of good work with prostate cancer. Same thing with testicular cancer. It's one of the most curable forms of cancer, but it has to be caught early on. So self-checks, and self-checks go for everybody, right? For men and their testicles and their breasts, and for women with your vulvas and your breasts, because you can get lumps and bumps on your vulvas as well. And the more you understand what your body is like normally, the more you can understand when it changes. Right? And that's what we really need to be clued on to. It's not the lumps and bumps that we already have, it's when those lumps and bumps change that we have to be really aware of that. And that's when we go to see a doctor. All right, anything else about the prostate before you? A prostate magic show. I wish I did. I wish I had like a magic show for it, but just tell me about it. So we usually hear about it when we're older, right? But the prostate has a lot to do with how males perform sexually. The reason I call it magic is because we can do something called milking the prostate. So what this means is if I insert something to the rectum, a finger or a penis or something, and I tap on it, much like we did the G-spot, what happens is that male will have an erection and ejaculate even if they're a quadriplegic. That's pretty impressive, yeah? Right? So it's completely separate from the usual nerve pathways, right?
Yeah, the sexual response from male didn't come from the brain.
It does come from the brain as well, but we can bypass everything and go right to the prostate. Yeah. So why would we do that? Why would we milk the prostate?
Why would we what? Sorry?
Why would we milk the prostate? Why would that happen?
To make sure that. Well, wouldn't it be in case somebody had an ED?
How to what?
ED?
Erectile dysfunction does help. This does help a lot, and in fact, that's one of the things that they'll often recommend with erectile dysfunction, is manipulating the prostate as well. So yes, absolutely. Why would somebody who is a quadriplegic or paraplegic want to have that done?
Kind of like the male G-spot
It's often called the male G-spot, yeah.
for pleasure.
Well, they actually can't feel it. Yeah. Those nerve endings, they can't communicate, right? Either way. So this is happening completely without their knowledge, understanding, or consent in terms of how their bodies are reacting. Any guesses why you would have that done?
Would it be if you like wanted to have children and stuff?
Yeah, it's for fertility. So we can still get that reproductive material, which is working fine, even if they can't get it out themselves. So instead of doing a surgery or anything like that, we can just milk the prostate and get that sperm sample right there. So let me get a little dark here for a moment, and I'll explain why I always bring this up. And I hope that you actually have a whole bunch of conversations with your friends and family about this, because it will help everybody in your life. All right. So remember I said it happens regardless of anything else, right? Doesn't even have to have nerve connection to the brain. So in cases of male rape, right, where the male is the victim, what often happens if they're being penetrated? They'll have an erection and they'll ejaculate. What might the person think if this is happening?
This is bad.
That what?
This is bad.
But why? What is my body doing though?
He is feeling pleasure, so he's like letting happen.
Yeah. Does this mean my body likes this? Does this mean I like this? This might be I have to reconsider my sexual orientation. This might be, oh my, did I want this to happen in some way? Right? This becomes a huge problem psychologically, right? Emotionally. And you're already dealing with rape. You're already dealing with a sexual assault. And now above that, you've got this, but my body reacted as if it was pleasurable. Same thing happens to women. Same thing happens on the female, because vaginal secretions will be released during rape, meaning the vaginal walls get moist, right? And you have to ask yourself, and an orgasm can occur. The fight or flight response looks almost exactly like the sexual response, right? Our palms get sweaty, our heart rate goes up, right? Our breathing goes up. It's all the same thing. So our bodies react in a similar way too. If men are scared, they can sometimes get erections because of that similarity in reaction. So if we know this, if we know that it's just the body, right? That's all it is. It's just how the body works. It's how it's hardwired. Then we don't have to have that extra added, did I like it? Was that something about me, right? But we don't talk about this, right? We don't know this. So that's why I really, of all the things to talk about from this class, I super hope that you have those conversations. You know, and it can always be, guess what I found out today, right? Because someone in your life has had this happen, and you probably don't know about it, right? Because we're not supposed to talk about these things, especially males. So if you let them know that, oh, this huge weight can come off of their shoulders, and they don't have to swim in that problem, in that mind issue. Does that make sense? Yeah.
Are we gonna talk about erections later on, or?
Oh yeah,
Because I have a kind of question that
please.
I don't know if I
Ask
should
away.
bring it up right now or.
Ask
bring it up
away.
later.
Yep, do it now.
So why is it that guys, when they wake up in the morning, they wake up with one?
So your body cycles.
Okay.
You'll actually have multiple erections at night, but usually with your sleep cycle, you wake up with one as well. That'll happen less as you get older, or at least it will be less intense. But yeah, that's just part of your sleep cycle. In fact, we use that if there's erectile dysfunction. We can put a little device around the penis that measures whether or not it gets erect during the night. And if it doesn't get erect, then we know it's not a psychological problem. It's a physical problem. Does that make sense?
Yeah.
Yeah.
Because I was like, sweet.
Right? well, one of my favorite films of all time, I think it is. I think I'm just going to have to call it my favorite film of all time. It's going to look at sex therapy. And there's a question about that too, about whether or not he can pee with an erection that comes into that morning erection thing. I have to wait for it though. It's good stuff. I can't wait to get there. All right, other questions? Any other questions before we move on to the prostate? All right. So the Cowper's gland. We talked about this one before when we were talking about the Bartholin's gland with females. What does the Cowper's gland create? Anybody remember? I know when we go to the female, so you can write this down. It won't make any sense to you right now, but later. Did you write it down? Like I wrote everything. It's so much. That's all right. I'll just tell you. So this is the pre-ejaculate generator. Remember we were talking about that? Does that ring a bell? So pre-cum or pre-ejaculate, it just means that a small amount of the semen, it would have no sperm in it by itself, but during the sexual response cycle that we'll look at later today, this would release a little bit of fluid. So that fluid is supposed to kind of make the way for when the semen really comes. So it coats the inside of the urethra, making it a little bit easier to go through. And it is also supposed to kind of clean up a little bit. So this is where it gets a little complicated because it cleans up the old sperm from the last ejaculate, right? Which means, let's say I am practicing the pull-out method, right? Which just means the male pulls out before ejaculation. What does still get deposited in the woman?
The old sperm.
The what?
The old sperm.
Yeah, so that pre-ejaculate is filled with old sperm. And now we know it can last up to 10 days. 10 days that sperm can last. So it's very, very, very likely that there's old sperm in there that is viable. So yes, you can get pregnant even if you haven't ejaculated anywhere near the person. Life will find a way. the anus, the same thing as we saw before in terms of lots of exposed nerve endings, all that fun stuff. But if we're going to go with the testicles, we'll look at the testicles more. We'll get a up close and personal look at the testicles. But the spermatic cord, that's what we're going to call the vas deferens when it gets into the testicles. And it's the epididymis that is the structure that matures the sperm. So we'll talk about that more when we get in there and look at, there's a bunch of parts of the epididymis. Get into that. The testis, so that's one testy, or the testis, that's two of them, excuse me. Testi is one, testis is two. You're up on your Latin. And then what covers the testis? Testes? What's the structure? Scrotum. What does the scrotum have that we talked about last time? Okay, what? Oh. Has the same muscle as, same kind of muscle? That dartos muscle? As the nipples. Yeah. So the nipples and the scrotum are made of the same kind of muscle. It's this flat muscle that goes all the way around. And when it is stimulated, it crinkles up, right? And in this case, helps elevate the scrotum. All right, let's see what I missed on my little things. Oh, let's talk about the foreskin. So the one thing I really don't like about this picture is it is missing the foreskin. So the foreskin would be like this if we looked on it on either side. Of course, it would wrap all the way around, but if we're just looking at it on either half. It can go down further too, depends on the foreskin. You can cover the penis completely. What is the foreskin there for?
Protection.
Protection. Yep, it protects the penis, and it helps keep the penis free from calluses. So one of the things that we know about circumcision, and it seems like I've said this in this class already. Have I? It seems like we were talking about this when we talked about the clitoral piercing.
Yes.
Yeah? That.
And it covers up so that way it won't create a callus as a kind of protection from rubbing off onto
Right.
something else, right?
Yeah, so it does the same thing with the penis, that if it's covering it, then it can remain sensitive. So the head of the penis is about 5 layers thick of the skin, which is about like the inside of your mouth. And if it's been circumcised, it becomes about 20 layers thick, and that's more like the back of your hand. So one of the ideas about circumcision is that you lose a lot of sensitivity. And a lot of males I've talked to have said, well, I don't need any more sensitivity. But that may not be true. It's hard to judge when you've never experienced anything else, because it often happens with babies. What we found in studies is that men who are circumcised tend to be rougher with their partners. The idea is that they may need to have more of a rough rubbing to experience the same feeling that men who are not circumcised experience. Does that make sense? Some men have opted to kind of have their foreskin redone. For some men, they can pull down the sides. They can stretch the sides of the penis and actually create a new foreskin. There are some surgeries that can do it. I don't know how good they are. I don't know much about those. But some men have kind of reclaimed their penis in that way. Questions?
So then, well, I was hearing that there's some circumcision is for keep clean the penis.
Yes, so that's been the biggest issue of cleanliness. We'll get more into it, but let's talk about it now. So the thing that we're trying to keep clean is between the foreskin and the penis, and even if you don't have a foreskin, you will have some of this, is one of my favorite words of all time, smegma. Right? What a great word. What a fun word. So a friend of mine, we just really like words, and we really like this word, and he tried to make his Gmail account smegmalad at Gmail, and it was already taken.
Oh.
What? It was just weird. Smegmalad, especially, like, I don't know what to say about that, but I like that there are that many people out there that like the word smegma. So smegma is a cheesy-like substance that develops between the foreskin of the penis and the glans penis. This is easy to remove. It's just a matter of pulling back the foreskin. By the way, you would not do this with a baby. A baby boy's foreskin is attached to his penis. You do not pull that back. That will happen on its own when it's ready to happen. But on adult, right, that's easily done. You can pull back on the foreskin. And that's what generally happens when erections occur. This foreskin gets pulled back. But to clean, pull back, and just wipe around the top. Part of the issue is if we're not being told how to clean our bodies, we develop sores in there. Anytime we have any kind of material that's left with our bodies, we're going to develop a sore. So if smegma is left in that area, it will have skin breakdown. So if I can clean it properly, then we don't have that problem. One of the things that came out was this study that was done in Africa that found that circumcised males were less likely to get HIV. But there's a few problems with that. And the main problem is hygiene. Is if I don't have clean water, then I can't practice good hygiene. And that was one of the main issues, was they were getting skin breakdown because of the smegma. But if we solve that, then we don't have those statistics. Does that make sense?
Yeah.
Yeah.
So, just like how you're saying, if something's left in there, it can cause a sore, made me think about like vaginal contraceptives that are the gel.
Mm-hmm.
Is that just like the vagina kind of cleans itself out and it's okay, or do you need to do like cleaning?
No, the vagina is very self-cleaning. Anything that we put in there, like spermicide, that just comes right out. Douching is one of the worst possible things that we could do for our bodies. So let me just get on my soapbox for a minute. Okay, so, and I don't even know why I say soapbox, because it's proven. I mean, when we're looking at clinically normal, this is way outside of normal. It's horrible stuff. Most of what douching is vinegar and water that you put into your vagina. It strips the lining of your vagina, which makes it much more likely that you get an infection of any kind, even a bacterial infection. So it's the opposite of what it's supposed to do, right? It's supposed to keep your vagina nice and healthy, and it doesn't. It wrecks it. So please do not use that. I found douche at a dollar store. I was just like going through and I was like, holy, like, oh my God. Oh my God, that's so awful. Like douching alone is bad, but douche from a dollar store, oh, I can't even imagine. Oh, that can't be good. Ugh. All right, so yeah, anything like that. The rectum actually, like, what do they call those? Let me put water up your butt.
Enema?
Enemas. Enemas aren't as dangerous. There's not that really delicate lining in the rectum. So that's fine if you want to do that, but yeah, definitely don't do that to the vagina. I don't remember what we were talking about that got us there, but did I answer your question?
Yes.
Oh, good. All right. All right, a couple more weird things. This is another one of my favorites. Okay, so there's a lot of misunderstanding about this, but I'm sure you have heard the phrase blue balls. What does that refer to?
When you don't essentially come.
Right, you don't ejaculate, right? But you're erect, you're excited, and you're being prevented from ejaculating for whatever reason, right? Some men will say that it causes them pain. I'm sure that it does. Some men will say that it causes them damage. That's not true. There's a few things you can do without your partner. You can masturbate, and that gets rid of it. Or you can just let it go away, and that happens too. It won't stay there forever, but it will eventually go away. The damage that people think that is happening, it only can happen in a very, very, very specific instance, okay? So this is not the normal thing. This is not, I'm not ejaculating when I want to and this happens. So, I'll give you the name first. It's called retrograde ejaculation. So let's say I've had an infection and it's caused some scar tissue in my urethra, right? And so here's where the damage is. So all this ejaculate, right, the sperm's going to come here, it's going to mix with all this ejaculate, and then it's going to try to go out here. It finds a block, right? Where's the only other place it can go? Backwards. And so it's going to go into the bladder. Right? It has nowhere else to go. It's the only, it can't really go back into the testicles. There's just not a way for it to do that. Instead, it goes up into the bladder. So, this does need to be fixed because there's a blockage that pee can't get out of either. But sperm in the bladder is not a dangerous thing. But it does need to be fixed because of the urine, right? That's the only time that would happen. But sometimes people believe that if they don't ejaculate when they want to, that will happen. But that's not true, right? All right. Let's see. What else? Oh, the most sensitive part of the penis, if you don't have one, if you have one, you probably know this, is on the underside. Everybody is different, so that may not be your specific most sensitive side, but that, for most people that is. And that is called a frenulum. As I said, I just like words.
It's not a vocabulary class.
Right? It could be. Oh, but what else do we- Okay. Oh, this isn't on here, but I'll ask you this. When do males' testicles drop? So it starts inside your body. When does it come outside?
Puberty.
Nope.
What, birth?
Nope.
Before birth.
Yes. Yeah, it's usually a male baby is born with testicles already descended. Sometimes it can take about 6 months. That's most men. For some men, it can take it up until puberty. That's where the undescended testicle jokes come from. But yeah, most people don't remember it at all because it happened before you were born. All right. Cool. All right, so this is the painful one. I'm sorry, gentlemen. This is I know, it's just such a, it's such a helpful slide, but yeah, I can see how it would be a very painful one to look at. All right, we'll go fast. You don't have to look at it too much. All right, the outer skin of the penis. That's where you have all those exposed nerve endings. They're close together, which makes it pleasurable. And then we have the blood and nerve supply to the penis. So this is what where all the feeling comes from. This is where all the blood comes from. That's going to eventually fill up those caverns. So one of the things that Masters and Johnson discovered was if you, let's say there's erectile dysfunction, right? You're having trouble keeping an erection. What they found was that you could actually place your thumb right at the base of the penis. I'm going to use, not to scale, right? So you would place your thumb right at the base of the penis on top, and that would collapse this. Because what's happening, what do we need for an erection? Blood, right? The blood's got to go in, and then it has to stay in there. Right? So what's happening with a lot of ED is the blood is going in, but then it's coming right back out again. Right? So if we can stop that from occurring, then the blood stays in the penis. Right? Cock rings do the same thing. So you'll see little leather bands or metal bands that go around. Make sure that if you're buying them, I would buy an adjustable one if you're doing it for the first time because don't want it too tight, which brings me to one of my favorite stories. So, once upon a time, there was a man who was, I don't know, bored, and he decided he wanted to know what it was like to inject cocaine into his penis. And so he did. And he got an amazing erection. Now, you know those commercials that say things like, if you have an erection more than 24 or 48 hours, whatever it is, go see a doctor? He didn't. So he waited 3 days. Yeah. So you know when you're a kid and you put a rubber band around your finger? Yeah, what happens?
Turns blue.
Wait, what?
Turns blue.
It turns blue, why?
Because it's cutting off circulation to it.
Yeah, blood can't get in there. What happens if blood doesn't get to a part of our body?
It breaks off. His penis broke off.
So, no, it rots from the inside. It becomes necrotic.
That's wrong.
So by the time they got to him, it was too much. The damage had already been done, right? It's like having a really, really tight rubber band around your finger for 3 days. That finger is gone at that point, right? It had no blood at all within it for 3 days. So they had to remove his penis. It was gone. Yeah. So what did we learn from this?
Do not inject cocaine into your penis.
Sometimes the lessons are really specific. That is a really specific one. Yeah, just don't inject cocaine in your penis. That's it. Cool. All right, I'm glad we can agree. I know, right? Go see a doctor. That's the other
That's
piece we
just
learned.
real
Yeah,
great.
yeah.
Yeah. All right. Now you know why I want to tape these, because I can't just put that on a PowerPoint, right? Cocaine guy. All right, the corpora cavernosa, because there are 2 of them. So this is what fills with blood that creates that erection. Right? That's how you can remember the cavernosa, right? Because it's the big cavern that fills with blood. It's kind of a gross picture in your mind, but it will stick with you. Why 2 of them? Why do we have 2 of anything in our bodies?
Because if one fails, the other one steps in.
Yep, that's it. This is a really important part of our bodies, right? This is part of reproduction. This is part of what keeps our species going. So yeah, if one fails, you still have the other one skulking in erection. All right, there's that corpus spongiosum. So corpus meaning just one. So it surrounds the urethra, and that's what that is. So it surrounds the urethra. It doesn't move. It doesn't collapse. It keeps the same structure, size, and shape all times. So it's still pliable, right? But it protects that urethra. Because again, that's one of the most important parts of the body, right? Got to get that urine out. We can get waste out, and we can get reproductive stuff out. We're in good shape. All right, other questions about this one?
I have a question, but I don't know if it's really well. I think I read in the book that say something about like mini organs or mini comes for a man. The main come and like a little bit.
That's that pre-ejaculate, pre-cum. That's that Cobra band.
Yeah, and that could happen many times or just one time?
Generally only happens once, but every body is different.
It's different.
Yeah, so it could happen
I
multiple
was
times.
confused about that because I was thinking like, how men can do it like that many times. I was thinking that come.
And we'll talk about multiple orgasms, but yeah, that wouldn't be associated with orgasm. That pre-ejaculate wouldn't be associated with orgasm at all.
Okay.
I mean, the person would be feeling pleasure, but it wouldn't be that height of pleasure kind of thing.
Okay.
Yeah. Any other questions? I do have to read you off this little note. I don't even remember writing this, but apparently I found this really interesting, and I still do. It says, Brazilian wandering spider kills you but causes erections. What? That's Past Fawn. Past Fawn wanted me to know that. Thanks, Past Fawn, but wish I'd read a little more.